Hi guys, my name is Nicholas. Welcome back to my channel. If you haven't already met me, I'm currently a junior doctor working in the NHS for about 2 years now. So some of you might be wondering, how is it like going through medical school and also working as a junior doctor in the UK? Or some of you might be interested to know how is it like being a Singaporean, studying and working overseas in the UK. So I thought it would be nice to have an honest conversation with you guys on some of the things which I wish I knew before entering medical school and becoming a doctor, so that you guys would have a better understanding on what this career path has to offer. Now, I think one of the most common questions that will be asked is if medical school is tough to go through, is it difficult? Medical school in the UK takes about 5 to 6 years to complete, depending on if you wanted to intercalate or not. Intercalation is basically taking a year out of medicine to do a degree or a master's of your choice. This can actually be a degree of your choice. So I have friends taking anatomy, some taking anesthesia or surgery, while I took a master's in public health just because I wanted a study break out of medicine. Now, to be very honest with you, passing medical school isn't difficult, but it can be quite challenging. You don't really have to be a genius to pass medical school, because the information that's being provided or taught to you, it's not rocket science. It's just the sheer amount of volume that you yourself have to process, which is the more challenging bit. Now, most medical students would actually quit medical school just because of the sheer amount of information they have to digest. If you can imagine a semester's worth of an A-level topic crammed into a month, that's basically what medical school is all about. So, if you actually put in the effort into studying and processing these information, medical school shouldn't be much of a problem to go through. Now, the most important factor that I have learned in helping me going through medical school is having a good supportive environment. And what I mean is having a close group of friends that you can actually share your feelings and also share your burdens with. Now, you want to be surrounding yourself in a healthy environment in what I call collaborative competition, and this is because your classmates are going to be your colleagues in the future. So there's no point being selfish and keeping information to yourself. Share, learn, and improve together, because trust me, no one can ever go through medical school alone. And for those medical students who are actually thinking of quitting medicine, fear not, you're not alone. I can bet you that if you ask any doctors out there, including me, I'm gonna tell you there's at least 5 times I actually thought of quitting medicine, and that's before every single exam in every year. Now, some of your friends will be telling you that,
oh, medical students, they're not fun. All they do is stay in the library and study all day. They don't get the full university experience.
let me tell you that they're wrong. Actually, lots of time for you to explore your hobbies and also your interests. In my university, they kept Wednesday afternoon off so that you will be able to attend societies and clubs. I have friends who actually took extreme sports such as skydiving. Some of them also did weightlifting and won some medals in weightlifting competition. Some of my highlights in university life was somehow I wanted to be a group fitness instructor, and I also got involved in one of the fashion shows which was organized by the medical students ourselves. So medical school is not all about just studying. You will have the opportunity to mix with other students from other courses and also really enjoy what university life has to offer. One of the many things that I wish I knew before I started a career in medicine was that medicine is actually a long learning journey. Because I could still remember how frustrated I was studying for the final year examination, to the point that I told my friends that, if I were ever to fall ill, I would rather crawl to the examination hall than to actually relive the experience of studying for the final year examinations. Passing medical school was one of the greatest moments in my life, because I told myself that I would never have to step foot in that godforsaken library ever again.
I was wrong.
Because when I started working as a junior doctor, there was new skills to be learned, new procedures to be done, new knowledge to be learned. Did a part-time degree in medical education, had to study for examinations to apply for the specialty of choice, and now I'm still doing a bit of reading to prepare myself in my career in anesthesia this coming August. If you're thinking of being a doctor, you need to be prepared that this learning journey is going to take at least 10 to 15 years to complete. Now, don't get me wrong here. I'm not complaining or anything. I do have a passion for medicine, and I also have a keen heart in caring and helping others. So I'm actually enjoying this journey, taking up additional courses if it means upgrading myself to provide better care and a better service to my patients. Some people will find this journey very difficult and tough, juggling between work, family, hobbies, and also interests. Now, imposter syndrome is something that I wish to discuss with everyone because it's actually a real thing. If I were to read out what imposter syndrome is here, basically it's a psychological occurrence in which an individual doubts their skills, talents, or accomplishments and has a persistent internalized fear of being exposed as a fraud. Now, imposter syndrome to me is all about feeling out of depth, feeling a bit of incompetency, or even doubting my abilities in being a doctor. It's very easy to feel like this in medicine just because you're working in an environment where you're surrounded with considerably smart doctors and also doctors that have more experience than you. Compounding on that, no matter how hard you try or study, there is definitely someone who knows more than you. And there is always something that you don't know. And also compounding on that, being a doctor, I do have a responsibility towards my patients and also making critical decisions in terms of their treatment and disease progression. Now, to give you an example on how imposter syndrome actually feels like, during my first day in the emergency department, that's when I was fresh off a foundation year 1 doctor. So moving from this cannulation, taking bloods, doing discharge letters, to actually seeing someone who came in from the emergency department and actually had to make a decision on whether this patient had to come into the hospital or could be discharged. I took actually 2 hours to try and figure out what's been going on. Then, after 4 months working in the emergency department, when you finally got the gist of things and how things are being run, you get switched off to trauma and orthopedics, where the first day they just gave me a patient's documentation saying that, oh, this patient is coming in for a hip surgery, would you clerk him in and do the relevant examination and investigations. And I was like, I have no idea what a hip surgery is. I've never seen one done in my life. Finally, when you got the gist of how trauma and orthopedics works, you're shipped off to the ICU. First day in the ICU, seeing one of the most critically ill patients in the hospital with lines and wires sticking out from every orifices in their body, and you're told to go and examine this patient here. I just told myself, I need a break. The point I'm trying to bring across here is that there's a lot of uncertainty in medicine. You know, there are times where you actually feel you don't belong, you feel incompetent, you feel like, you know, I've studied 5 years in medical school, but I still don't know anything. This feeling is real. I've experienced it myself multiple times. The only question that I'm gonna ask you is, what are you gonna do about it? Are you going to let it consume you? The truth is, we're all humans, and knowledge is infinite. No one's perfect in this world unless Elon Musk succeeds in his Neuralink and allows us to download medical books directly into our brain. Failure and uncertainty is part and parcel of life and in medicine. Know what you're worth, you know? Be confident in yourself and also embrace uncertainty. I know it's much easier said than done. I still have trouble dealing with it, but I've accepted the fact that I can't know everything in this world. But I continue to do my best to learning as much as I can and also to give my patients the best approach based on my current level of knowledge. Now, being a doctor can be very challenging, but the satisfaction that it actually provides me is immeasurable. Every day is different. The people that you meet, the friendships that you actually forge, it allows me to be involved with the life of others, whether it being delivery of good news or bad news. You know, sometimes people would ask me, if I were to be born again, what would I do? You know what? My answer still stays the same because I feel that there is no other job in this world that will make me feel more satisfied in life. Now, I hope this video has helped you understand more about what it's like working as a doctor and also studying in medical school. If you like what I do, please give me a like and subscribe. If not, enjoy your day ahead. Thank you for watching.